Hey guys, hello. Good evening. Today is Thursday, October 30th. I am going to get right into this video because I don't want to waste any time at all. I'm going to get right into this video, okay? So before I get into anything, let me just kind of share my screen here. I'm just going to introduce myself for anybody that may be watching and new to me. I'm just going to go ahead and introduce myself to you guys. My name is Kendra, aka Miss K. I am a medical assistant instructor. I've been a medical assistant instructor since 2011, and I've been a medical assistant since 2004. So literally next month, well, it's not November yet. In December, it will be 20 years since I have been a medical assistant. I became a medical assistant. I finished school, well, I finished externship December 2004. So I've been a medical assistant 20 years in December and an instructor since 2011. I'm a mom, I'm an author and entrepreneur. Some of the things that I sell are my t-shirts and mugs and things like that, my stethoscope necklace. And as you guys probably already know, I do have a MA refresher course. So if you are watching this and if you are preparing for certification, you can get my refresher course at marefreshercourse.com. This is for anyone who's preparing for certification. Also, any medical assistant who is seasoned and you just need a refresher. You've been out of school for a long time, you need a refresher. Also, if you are a medical assistant instructor or you're trying to become an instructor, consider referring your students to this course. You can become an affiliate. I have one of my instructor friends who is an affiliate. So as she refers her students, she gets a commission. So, and this goes for anybody who wants to be an affiliate. I will leave the link in the description box so you can become an affiliate if you would like to. So we're going to go ahead and get right into this video because I don't want to waste any time. This video is strictly for anybody who wants to become a medical assistant instructor. I've gotten this question quite a few times since I've been going live. For those of you that don't know, I've been going live all month of October, all October, every single day. And a few of you guys asked Miss K, how can I become an instructor as well? So I just want to give a few tips, and I'm just going to give just a few tips for this video since I'm live. However, I'm going to do another video going more into detail. So I'm just going to give a few tips for the people that asked me to, and then I am going to do another video going more into detail about getting the job once you get it, how to stay organized as an instructor and all of that. But for this video, I'm just going to do a just a few tips. And I see some of your questions here, guys. I'm gonna get to the questions. I'm gonna go over the tips on how to become an instructor, and then I'll get to your questions because for people that's watching a replay and they just want these tips, I want them to be able to just watch it and then exit out the video if they don't want to stay for the Q&A. So if anybody here has a question, don't worry. I'll get to it in a second. I feel like I'm about to sneeze. Hold. Excuse me. Yeah, my allergies are killing me, y'all. It's that time of year. I thought spring was bad, but y'all probably know, y'all been live with me every single day. My allergy, well, just about every day, my allergies have been acting up. I thought spring was bad, but it's actually fall that seems to be the worst. Thank you, Soraya. All right, so let's get in some of these tips. I'm just going to give you guys a few tips. So again, I'll give a more detailed video later, but we just want to talk about for tips. So this is for anybody who is like Miss K. I've been a medical assistant for a while. How do I become an instructor? So the very first thing that I would tell you guys to do is to first ask yourself, is teaching for me? And the reason why I say that is because you know how we have to have a level of patience when we're dealing with patients. You know, being in healthcare, you need a certain level of patience, right? But when it comes to teaching, you need an extra level of patience because now you are teaching something to someone who has no, most of the people have no medical background at all. Some do, but for the most part, they don't. You're teaching like something like terminology, right? Medical terminology. When you're learning medical terminology, you're literally learning a whole new language. And so when you're teaching something like medical terminology where they're learning this for the first time ever, you have to have a level of patience. So I really want you guys that's thinking about becoming an instructor, ask yourself, do I enjoy teaching? Is teaching for me? Do I have patience? Am I prepared to have to answer questions? Am I prepared am I a people person? Some of the same questions you have to ask yourself when trying to decide if medical assistant itself is right for you The same questions you have to ask yourself are the very questions you have to ask yourself when you're trying to decide if teaching medical assistant is right for you. Also, know that some of your work will come home with you. Okay. When you leave your school, a lot of times you're not just leaving your job. I don't know, y'all know teaching comes home with you, right? Whether you're a medical assistant instructor or elementary, high school, you're teaching, your work kind of goes home with you because you have your teaching hours to teach, and then you got to check assignments and all of that. So I really want you guys to ask yourself, is teaching for me? I love teaching. And so I knew teaching was for me because I love teaching. Matter of fact, I can't help myself because every time I learn something new, I have to stop myself from teaching other people. As soon as I learn something new, I'm ready to go create a lesson on it. This is how you do this. But you really want to know, is teaching for you? Okay. Am I patient? Am I kind? Do I love people? Same, like I said, some of the same questions you ask yourself for medical assistant. Okay. And also, am I ready for it? Because you could love teaching and not necessarily be ready for it. Okay. So I really want you to like really start thinking about that. And I have a previous video on this as well, where I talked about some of the other attributes that you have to have as an MA instructor. That video is a few years old, but I'll link that in the description box as well for anybody who wants to see it. So that's one of the things you want to ask yourself. Okay. Another thing you want to do is simply search for MA schools in your city and state and compile a list. Now, for those of you that are in like small cities, you may only have like one school, one or two schools, right? So this may not apply to you. But if you're somebody like me, I live in a city. I'm in the we call this the DMV, right? DC, Maryland, and Virginia. This is a big area. There are so many schools in this area, so many medical assistant schools in this area. So if you're like me and you live like in a big city or in an area like DMV, like this area like this, a big area like this, you may have a bunch of schools because we got schools in DC, we got schools in Maryland and Virginia. So you want to just search for it, go online, Google, and then compile a list of medical assistant schools in your area. Along with that, look for workforce development programs too. So don't just look up medical assistant schools. Also add to that workforce development programs, because workforce development programs in your city, they may include medical assistant as well. Okay. And then once you have that list, compile a list and write down the address and all of that, know where they are, call around to those schools and then simply find out what their criteria is. Okay. Some of them will say, okay, you need to have 3 years of experience as a medical assistant, right? You need to have some may be even 4 or 5 years or more. Some may say you need an associate's degree. Some may say you need to absolutely be certified, right? And so call to find out if they're hiring, and if they are, ask them what is the criteria to be an instructor for your school. Some schools are more lenient than other. The school I worked at years ago, it was the school I attended when I was in school 20 years ago. And then I ended up teaching there about 7 years later. Wait a minute, no. Yeah, about 7 years later. But some of the instructors were literally like fresh out of school because they needed instructors that bad. They were good students and they became like not instructors, but like co-instructors. So I just say that to say that even if you haven't been in the field for 3 or 4 years, you were a good student. You've had a couple of years of experience. You can always still try because you never know. They may say 2 years is enough. So again, make sure it's for you. Ask yourself those questions. Search for MA schools in your city and state, and then compile that list and call around to find out what their criteria is. Okay, they may want you to be certified in the certification that they offer. For an example, if the students at that school take the RMA, they may want you to have the RMA. Okay, or same thing, CCMA or CMA AMA. They may not care, but they may have a preference. So you do want to find that, and then the last thing I'll share with you guys is that you're going to need to prepare a teaching demo. So for the young lady, if you're here, you asked this question, I think last night. A few of you have asked since I've been doing this live. I had about 3 people ask, but I know for sure the one young lady was here last night. She said she would be here tonight. But you want to think about your favorite body system. I always recommend using that as a teaching demo. Whatever your favorite body system is that you feel like you can just explain with no materials or whatever, choose that body system. And you want to just simply create a lesson on the structures. You can never go wrong with starting with the structures of the system. and then you want to explain the functions of each of those structures, right? Um, if they don't let you pick your own system, then you may have to come up with something on the spot, because some schools, they may not necessarily give you a choice. I think my very first teaching job, they gave me a choice, and I chose the cardiovascular system. And even to this day, I think the circulatory system, the blood, the heart, all of that, the blood vessels, I think that's my favorite to this day. But if they allow you to just choose whatever your favorite body system is, if not, then like I said, you're gonna have to just come up with something on the spot. But I want to say, did my second school, did they make me I can't remember if I was able to choose that second time with that second school. I can't remember. But anyway, if you're able to choose, um, just choose your favorite body system, and that's it. Just prepare like a 5-minute lesson and make it fun. So if you're about to do a teaching demo, guys, make it fun. Have some handouts. Okay. One of the things I did, I'll never forget, and y'all, this was all the way back in 2011. I'll never forget that. One of the first things I asked them, it was like the program director, some other instructors, and all of that was in the room. And one of the first things I asked them, because I did the blood and the heart and all of that, I said, do you guys know that blood is not just this red thing running throughout your body? And they just started cracking up laughing. I was like, people feel like blood is just this red stuff. And so that's how I got into explaining what blood does, right? And so just kind of make it fun. Have some type of printouts to give them, so that way they can be impressed with your teaching demo. Have some handouts, ask questions, like, what do you guys know about the cardiovascular system? Or what do you guys know about the respiratory system or the digestive system, right? See, have people raise their hands, act like you're really teaching, okay? And what else I was going to say about the teaching demo, but that's pretty much it. Just act like you're actually teaching. Have some printouts, even have a little assignment, have something for them to do that'll take maybe like 30 seconds. And even if it's like, one thing I used to do as an icebreaker with my students, I would write cardiovascular system at the top of the board, and I would give them, like, let's just say a minute, and see who could come up with the most words out of cardiovascular system, right? So something fun like that, okay? And I'll just give one more last thing, and then I'm going to, like I said, I'll get more into this in another video, but I'll just say this. If you are hired, you want to just make sure you read and study the textbook and the curriculum. That's one thing I would say, is if you do get hired, make sure you become very familiar with the textbook and the curriculum. So if they do hire you, just ask them, hey, can I get, once they say you have the job, ask them for the textbook and the curriculum. That means any outlines they have created, testing plans, all of that. Okay. So hopefully this was helpful. So once again, guys, for anybody that just joined, I got this question for a few people, from a few people, to do this video talking about how to become a medical assistant instructor. The first thing I said was, ask yourself, is teaching for me? Be real with yourself, okay? Ask yourself, is teaching for me? Also, you want to search for some medical assistant schools in your area, compile a list, call around to those schools, find out the criteria. Do you need to be certified? Do you have to have a certain amount of years? Like, what is it that you're looking for an instructor? And of course, ask if they're hiring. Once you do that, you're going to also prepare a teaching demo. Most schools, I don't think there's no school that's just going to bring you on without having you do a teaching demo. So you want to just already be prepared for that. So honestly, for those of you that's already trying to become an instructor, I would say go ahead and prepare your teaching demo now. Even if you don't have any interviews coming up, just have that ready now. So that way, when you do call around to the schools, I say they're hiring right on the spot, or they're interviewing right on the spot, you already got your teaching demo ready, because you never know when they may just throw it at you. Okay. And then also, I mentioned, if you do get hired, read and study the textbook and curriculum. But I'm going to come back and do an actual video, not a live, because I know doing lives for stuff like this can be very distracting. All right, guys, let me see if you have any questions out here. Good nursing and medical trainer said, thanks for sharing. Oh, okay. Sarai says, leave and I'll be back soon. Okay, Sarai, I don't know if you're already gone or not. Sarai, I see your message. You said you have a problem, you need advice. Are you still here, Sarai? How do you get your name highlighted? Honestly, his name is highlighted. I can't tell. Oh, you know what? Let me. Oh, someone might have mentioned honestly. Maybe that's why it's highlighted. Let me see. Let me go to YouTube on here. Let me see. Honestly, you want to be a I'm about to make you a my live chat moderator since you here every time. I'm gonna make you a live chat because you seem like you already moderating as it is. So I'm about to make you a moderator. Add as moderator. If anybody else would like to be a moderator as well, let me know. I can add you as a moderator too. That just means you just help manage the chat. So if you see something crazy, somebody putting cuss words or something in the chat acting up, you can simply just remove it for me. If anybody else wants to be a moderator, let me know. I can do that now. All right, let me see. I don't see many questions. Oh, good nursing and medical trainer says I'm the owner. Okay. Okay, good nursing and medical trainer. That's good to know. So let me know if I was on point with what I told them. I'm going to get into more tips on actually for medical assistant instructors, like just how to stay organized and stuff like that. But tonight I just wanted to just give a few tips on what to do when you are looking for a school, how to become an instructor. But I'm definitely going to give you guys some more tips, and it's going to be a video. It's not going to be a live. It's just going to be a straight to the point video. And I already had the tips already in my banners ready to go on the screen, but I just decided I want to do a video instead because I talk about how to stay organized, how to keep your students engaged, how to get them to pass certification, because that's another thing too. You're going to be responsible for your students passing certification. And for me, I've had a really high success rate. I was at 100% for a while until I had a couple students that didn't pass. And it's okay because some people, it takes them a couple times, some 2 or 3 times. It's okay. But just know that I'm going to give some tips on how to ensure the success of your students when it comes to certification. Okay. I love you too, Maitland. Oh, you're a nurse and CNA instructor. Okay, cool, cool. Congratulations, why you go? I gotta put why you go on the screen. Congratulations. Um, good nursing and medical trainer says, I love the administration side and I love teaching. You know what's so funny? I like administration too. I didn't think I would like it. The school that I teach for now, when I first started, I was teaching the administrative courses and I did not want to. I fought against it and I loved it. And then as soon as I started loving it, then they want to bring me over to the clinical side after. And then I fought against the clinical side because I'm like, y'all done got me all attached to the admin side. Now I had to switch over to the clinical side, but now I'm glad I did. I'm glad I did. Hey, Deidre. Hey, Jackie. Hey, Michelle. They're telling you congratulations, Wayuka. Hey, Ashley, Jessica, Staten Island in the house. All right, let's see. Hey, Jamie. Yes, they have to go positive vibes only. Yes. So if anybody else wants to be a moderator, let me know. Oh yeah, you can call in, Soraya. Let me put it in the thing real quick. If anybody wants to call in, I'm gonna put it in the chat. I have a Zoom at 8, y'all, so I'm not going to stay on too long. I got a Zoom. I work with a school in Texas, and we do a study session every other Wednesday. So I got to get on Zoom on 8 at 8. It's 7:30 here. I don't know what time it is for you, but my time is 7:30, so I'm not going to be on here long. Soraya, I get to see you. Hi.
Hi, Miss K. How you doing?
Hold on. Well, why can't I gotta hold on. That's why I can't see you. Hold on. There you go. Hi, Soraya.
Hi, Miss K. How you
It's
doing?
nice to finally meet you. Y'all, listen, Soraya always calls in and I always see her name. So when I tell y'all I'm so excited to see her right now, just imagine you always hear them and now it's nice to put a face to a name. You're so cute, Soraya. Oh,
Thank you.
you're welcome.
I have a question. Well, it's kind of like a problem. I went through,
Okay.
it's not deal with medical instructor and training, it's deal with medical and externship. I
Okay.
went through step four.
Okay.
I know a lot of people have questions about step four. Is it real? Is it legit? Seeing the advertisement on TikTok. It's a real, it's legit, but the only problem is it all depends on where your area at. I live like in a suburban area, not like a
Okay.
it's not a lot of people, not a population, and I'm in Pennsylvania, but
Okay.
it's kind of hard for me to get an externship. But they're available to give me an externship, but it's all full until January.
Oh,
So I'm taking my NHA next week. Cross the fingers I pass. I've been studying,
you
but
will.
they came up with this thing is they can send me an at home kit for me to do um
The
phlebotomy.
venipuncture.
Yeah, then I'm not sure they're gonna send me like a it's a very limited spots.
Mm-hmm.
They said they can send me a kit and everything. Then once it's a 3 week program, the kit, and it's
Okay.
virtual, but it's like hands on, but virtual. I have the kit, and once I
Got you.
finish, it's like a cohort. They'll like help me find a job,
Okay.
or I can wait until January to have my externship. I'm more honestly, stuff was very hard for me. Not
Okay.
not the work, just that I
Mm-hmm.
like things hands on.
Yeah.
If someone can do it virtually, it's good. I passed it, but it
Mm-hmm.
was very hard for me
Got you.
to keep concentrating. So I like to do hands on stuff. But my
Got you.
problem is I want to do a hands on externship. I feel like passed that for because I know I passed because I needed to pass. I feel like I don't really I didn't remember stuff to pass my NHA. I just remember just how to pass the class.
Mm-hmm.
So my question is, I already declined it, but I'm thinking about if I should second think it. Um,
Okay.
should I accepted to do my still want to do my externship until in January,
Yeah.
or should I wait till them to send me the stuff? This could happen in a couple weeks. Then hopefully they'll find me a job. But I want the more hands-on training first before I go for
Yeah.
in person.
I think you should accept the kit, Sarai. I think you should accept it.
Really?
Yeah, because you're going to be getting your practice in, right? Are you when you get your practice in, you're still going to be able to get the externship, right?
No, it's either I do
Oh,
the
either
kit,
or.
or and then once I have to get the kit, then I have to pass my NHA as well.
Okay, got you. So it's
Then
basically like you on your own. If you take the kit, you're basically on your own, basically.
yeah, but
Okay.
it's like a 3 week, but I still do it virtually. But I will have the kit with me physically.
Okay, gotcha. Okay, so okay, because I was gonna say if you getting a kid and then you still gonna January. Okay, so I see what you're saying. So it kind of depends. Like, do you think like how do you feel about doing it on your own at home? I know it's virtual, but how do you feel about that? Like the thought of being virtual, doing this being a function. How do you feel about it?
I feel like virtual probably might speed up things. Hopefully, I'll get a job by then. But I want to do the more hands-on stuff.
Yeah,
I want
yeah,
to do hands-on with in person. So, but a lot
but
of places want me to have an externship or some type of little bit experience besides me having my NHA. They still
yeah.
want me to have my externship. So that's something
Mhm.
I'm contemplating about. But I already decided I'm going to wait till January to do my
Okay,
externship. So
okay.
that's
So
something I wanted your opinion on.
yeah, I got you. Because that would be nice if you can get the kit and still. I didn't. Okay, so it's either or basically.
Because
Yeah.
it's limited spots.
Got you, got you. I mean, at least January, that'll give you some time to, study and stuff like that. Because we about to be in November, so it's not a lot of
Yeah.
time anyway.
Yeah.
So it's not going to be too much time. That'll give you time to prepare and all that stuff. So I think that's fine. Wait until January. It would
Yeah.
have been nice if you could get both, but I get it. It's not enough spots.
Yeah, and I feel like I'm besides your practice tests and everything, I've been going through other online apps and websites to do
Mhm.
practice stuff, and it's feel like I'm not retaining the information to it's multiple choice. I'm not retaining the information when it's time to do the multiple choice. Like my grade is not very high, but I feel like
Okay.
I'm trying to study. I'm writing these things down, but when it's time to memorize it, it's just not
Yeah.
there, and that's like kind of set me back and kind of make me
Okay.
cautious about second think if I'm going to pass this test.
Got you. Okay. I'm
Absorbing
gonna take.
everything.
Have you done any of the quiz? You have done the quizzes in my course, right? Because I can
Yes,
go.
and I
Okay,
did
I'm gonna go.
pass it.
Okay, I'm gonna go take a look and see how you doing over there. But I was gonna say, what are your strong areas? Like, what's the areas on a test that you know that you're really good with?
More probably, like you said before, probably more kind of like the administrative side
Okay,
and like numbers. I'm not good with like
got you.
dosage and
Okay,
like the angle of how like the needle is. I think it's a 15-degree needle, 15 degrees. That's how much you're supposed to insert the needle.
for which one? 15 degree for intradermal.
Yeah, intradermal,
Yeah,
intradermal, intermuscular, or subconscious.
sub
I,
Q.
yeah, subcutis. I can't pronounce it.
Mhm.
Those that make me hesitant.
Got you. Okay.
And what's it called? EKG. That,
Mm-hmm.
those are just my problem factors. Sorry if I'm taking too much of your time.
And no, it's okay. You fine. What I always the reason why I asked that is because I just wanted to make sure you knew your strong areas. So I would kind of put them to the side for a second, your strong areas, and I would just hone in on those weak areas that you said. Like you said, the dosage calculation, EKG. So, I got the module on dosage calculations in the course. So I will go over that. If you need to go over it again, I also got I have dosage calculation videos on YouTube as well, on my channel as well. But I will hone in on making sure you got those things, because sometimes you know how you struggle with something and you try to avoid it,
Yeah.
right? So I want you to like really hone in on studying those things that you struggle with, the EKG placements, the interpretation, like all of that. Try to focus on getting that stuff first, and then the stuff you feel good about, like the administrative stuff, just kind of put that to the side for now, for a few days, and focus on that EKG stuff and the dosage calculations. Yeah, one at a time. So you might say, tomorrow, you might say, okay, I'm gonna focus on dosage calculations tomorrow. With the dosage calculations, you want to make sure you know how to, of course, calculate, the D over H, right? What the doctor wants, what the doctor
Yeah.
ordered, divided by what you have on hand, right? And then make sure you know how to do that. The pediatric doses as well.
I
Okay.
think
So,
yeah, the pediatric. I think was it the 2.2.
mhm.
Was it grams or milligrams?
um, yeah, the kilograms.
Yeah,
So
kilograms.
pounds, yeah. So if it's in pounds, the first thing you do with pediatrics is you convert that pounds to kilograms, divide by 2.2, and then and you'll see it in the video, because I don't want to say too much and then confuse it, because it's kind of confusing when you can't see it
Yeah,
on
I was
paper.
just saying it, but I'm just
Yeah,
a little bit nervous, and I
I
just want.
got you. Yeah, yeah, and you're gonna do fine. I'm gonna look at your scores and see how you're doing over there. But yeah, just tomorrow, dosage calculations, make sure you got that, and then move on to the next thing. What day is your test?
Election day, November 5th.
Oh, it's next. Oh, yeah, we gotta get. Okay, yeah, definitely. Okay, focus on that tomorrow. Dosage calculations, and then of course, you can email me too.
Yeah.
If you have any issues, if we gotta hop on Zoom or something like that, we can. Because I want to make sure you got what you need. So I would say that. So EKG, dosage, and anything else that you struggle with, let that be your focus these next few days, next couple of days. Okay.
Okay.
And then that test plan. Did you download the test plan for CCMA?
No, not yet. No.
Okay, so do that too, because you want to use that as a checklist just
Oh,
to make
like it
sure.
has like fundamentals. It
Yes,
tells me like the grade or how high it is and stuff.
exactly. Yeah, you
Okay.
got that.
Yes.
Okay, yeah. So use that as a checklist. So everything just kind of check it off, and then anything you don't know, then make sure after you go over the dosage calculations, the EKG, you go back over those things.
Okay.
Yeah. Yeah. But it's good to meet you. It's good to put a name to a face now. And like
Nice.
I said, and please don't hesitate to reach out, because you got the course. You guys that have my course, feel free to reach out. If we have to hop on a Zoom or something like that for a few minutes, that's fine. But for those of you that are in my MA refresher course, which you guys see the site on the screen, do not hesitate to reach out if you're struggling with anything.
Okay. Thank you so much,
Okay.
Miss Cat.
You're welcome, Sarai. Good night. Um, let's see. Oh, she said you 1 point. Okay, yes, and please do one on one. Please do one on getting a job. Oh yeah, I've had many interviews and they told me I did pretty good, but nobody has called. So Jamie, I did a live a couple of weeks ago on interview tips, like literally 2 weeks ago. If you look on my playlist, the lives, and you'll see it. But I did some interview tips, and that was one of the things I talked about too. If you guys are going on interviews, and even if they're complimenting you, but for some reason you're not getting the job, I would recommend doing like some mock interviews. I know the MA specialist, she helps with that, doing some mock interviews. And but I did give some of those tips on that video a couple of weeks ago. Let me see, what time is it? 7:42. Okay, so I gotta get off here. One of the school here has a 52% pass rate. You know what? That's a good question to ask. Actually, honestly, thank you for mentioning that. If you when you guys are calling around to the schools as MA instructors, I mean, as new MA instructors, you're trying to become an instructor, you do want to find out, that's one of the questions that I ask now. When I was a new instructor, honestly, I wasn't thinking about that. And you might not even be either. Maybe you just want to get in and start getting experience. That's fine too. But for me, before I attach myself to a school now, I need to know the passing rate for certification. How well is the school preparing them for certification? And I need to know the job placement rates. Are your students getting it? Are your students getting jobs? Okay, those are things I do ask. Good nursing and training says, and medical training says perhaps I can recommend. Yeah, definitely. It's oh, I meant to let me come back over here. Where is it? Yeah, I meant to keep that on the screen. But marefreshercourse.com. Yeah. I have a high passing rate. Like I said, people have the course they've been passing. My students are passing, my YouTube students are passing. So I have a pretty good success rate. So I definitely recommend my MA refresher course. And I use the test plans from the certifications to create the study guide. Okay, let me see. I'm gonna read a couple of more of these. 2-week vacation in February for a while, and I want to know what is the best choice for applying for jobs. Oh, no, you don't have to wait. You don't honestly, L, if you it's so it's up to you, right? So if you need the job now, and this is for anybody, L asked a really good question. She has a 2-week vacation coming up in February, and she wants to know, should she wait to apply for jobs? So um if you guys it can go a couple different ways. So my students, I've had a student with this very same dilemma, but see, she was already working somewhere, but she was trying to find an MA job. So for her, she was able to wait because she was already working somewhere, right? Not an MA job, but she was like a cashier or something in the store, I think. And so she already had a job, so she was able to wait. But if you guys are, you're needing a job, like you need a job, you need to start working now, I would still apply and just always let your job know that you have a vacation coming up, and just make sure it's okay, because it's February. Now, right now it's what, it's about to be November, so you still got a couple of months. So I would still apply. Let's just say something comes through like next week or the next couple of weeks, you still have a couple months before your trip. So I would just let them know in advance. They offer you the job, um let them know that you had this pre-booked vacation. Okay. But I wouldn't put it off. So anybody that's thinking about this very same thing, you have a vacation plan, I wouldn't put it off. Now, and I'll tell y'all this real quick, and I'm gonna get ready to go because it's 7:45 and my Zoom is at 8. I'm gonna let y'all go. Now, I've had students who had a trip plan and then they started school. Something like school, I would recommend putting off, because y'all know with school, you can only miss a certain amount of days. So, like, for an example, my program, my students can't miss more than 4 days. And so I had a student who was going to, like, she was going somewhere for a week. And so for her, she ended up having to leave the program she had to leave the program and just start over another semester, because you can't miss more than 4 days. So something like that, like if you're about to start school and you're going to be out a whole week, something like that, I would recommend just waiting, because MA schools are constantly starting either every month, every couple of months, every semester. But as far as jobs, and I see you said you're already working. So yeah, I would say if you are good, you can put it off for now and then wait until after your vacation. you know, um, will apply, since I just passed my exam, and inform them in the interview to see what they say to on deciding between the two. So because you already have a job, it's kind of up to you, to be honest, L, because you already have a job, you can put it off. I don't think you have to put it off though. I don't think you have to put it off just because you have a vacation coming up. Um, I don't think you have to. But my student that put it off, it was just because she had a job. She was good. She was like, I'm fine to wait. I'll wait till after my trip or whatever. So it's kind of up to you. You have a choice, so that's good. But I wouldn't put it off only because you have that trip coming. So hopefully that helps. And you work at a salon, you do hair, L. Let me find out. Hey, Tanya. All right, let me look back here. Let me make sure. Let me see. I'm going to go back just to make sure I didn't forget anything. Good nursing and medical training says, I'd love to know more about your prep program. If you're still here, I'll put my email. You can feel free to email me. I can tell you more about it. It's khartcpr@gmail.com. If you're still here, good nursing and medical training, I can tell you more about it, but I just put my email in the chat. Feel free to email me at khartcpr@gmail.com, and I can definitely tell you more about it. Oh, she said I'm a receptionist. Okay, gotcha. Okay. I was about to come get my hair done. All right, y'all. It is 7:47. I just wanted to see if medical training message back if she's still on here. If not, Make all right, y'all. Y'all know tomorrow is the last day so for those of you that didn't know, I've been going live every single day. Tanya been here every day. Elle been here every day. Soraya, Jackie, all of y'all that been here every day. Honestly, I'm surprised y'all not tired of me yet. Why Yuka been here? Like, listen, y'all. When I tell y'all once tomorrow over, I don't know the next time I'm going live because my voice is tired. I'm very tired. So I don't know, but I've really enjoyed y'all. I have really, really enjoyed y'all. I really have. Y'all have no idea. Do me a favor, y'all. Come on camera tomorrow. Honestly, Elle, Tanya, Jackie, all of y'all, come on up here tomorrow. Do that for me. Log in. Let me, or at least even if you don't come on camera, at least call in so I can talk to y'all and hear y'all, even if I can't see y'all. Do me that favor, y'all. If y'all don't mind, I'll leave the calling link tomorrow, and I'll have y'all call in if y'all are up to it. All right, y'all. Y'all have a good night. I got to get ready for this session in about 10 minutes. Y'all have a good night. See y'all tomorrow.